Hey, and welcome back to another episode of the Pint-Sized Podcast Roundups. Today we're discussing episode 37 with Claire Robertson about patellofemoral pain. So, as always, to kick us off, what is patellofemoral pain, I hear you ask?
It's an umbrella term, and that's a dilemma in many ways, because you could get anything from a patient who's an obese 13-year-old who's not participating in any sport, barely, to a 45-year-old ultramarathon runner, both with patellofemoral pain, and yet the drivers, the risk factors and the drivers for those two patients are really different. But any pain that originates from the patellofemoral joint or the parapatellar soft tissues that's generally anteriorly located but not always, so it can be medially, laterally, or even in the popliteal fossa, but aggravated by activities such as stairs, getting out of a chair, walking downhill. And if necessary, if you eliminate other pathologies like meniscal pathology, then the chances are you're left with patellofemoral pain.
You're looking for an insidious onset and the absence of trauma, and generally speaking, PFP shouldn't have a fusion. So if you're seeing a patient who has issues with, say, standing, walking, rotational movements, you may want to take a moment, pause, and ask yourself, is it possible it's meniscal or fat pad issue in nature? Because it's such a catch-all umbrella term, your treatment plan also has to factor in that individual. So you should always try to tailor it around their issues. If they're complaining of a cinema sign, issues with sitting with their knees bent at 90 degrees, then you're looking at a more muscle length rather than biomechanical or endurance-related issue due to the compressive vector on the patellofemoral joint. If there's an individual who's complaining of pain at the end of their working day, then it's more indicative of a muscular endurance issue causing a shift. With exercise therapy, something to keep in mind, even if it's just 3 exercises or more, we want to fatigue the muscles to cause an adaptation. So whatever exercises you give the patient, make sure that the load is tailored to them as an individual, rather than the same exercise you'd give to 70-year-old Dorothy to 13-year-old Timmy. And yes, mechanics can play an impact in the issue with maltracking of the patella, which can be influenced by the foot and the hip, etc., as you could potentially have higher loads on the patellofemoral joint within the trochlea. So work on dynamic movements as best possible to encourage better, not perfect, movement. And keep in mind, your PFP issue may not show up alone, and it may bring some buddies. You know, the usual suspects, ITB syndrome or Hoffer's fat pad issues. So be ready to work on multiple fronts. With these inflammatory conditions, you don't want to push through the pain. So you may have to begin with isometric work between 30 to 50 degrees, a sort of happy medium space between all the particular issues that you may have with extension or flexion loaded positions. And sometimes, hear me out, this may come as a bit of a shock, strength work isn't the be all and end all. You can't just do some heavy squats and think that the pain will resolve. What do you think when you have the avid gym goer who could leg press you to oblivion and you tell them that they're not strong enough? So there will be times where you need to look at those biomechanics that we've already mentioned and look at what aspects of their movement may be influencing their pain and work on that fine motor control. Patella instability is also a player here. If they've a shallow trochlea, that will factor in. Then you've got a high riding patella. Look for the distance between the tibial tuberosity and the patella and the top of the patella. They should be about equal. If the tib tuberosity and the apex have a larger distance, then it's high riding. This will often impact, say, over 30 to 40 degrees of flexion, and that's where you'll need to have to make sure that you're doing your stability work, that fine motor control work. If you want to find out more, if you want to hear more of the conversation that we had with Claire, as always, check out the link in the description or wherever you go to find your podcast. And I've been Sunny from Physiotutors. Thank you for listening. Don't forget to hit that like button.